Since September is Prostate Cancer Awareness Month, we're going to take a moment to do some education on the latest in the battle when it comes to genetic testing for men. Dr. Mark Edney is here with that information. Doctor, before we kind of jump into this testing and what's new, can we kind of start with treatment options first and what is available there?
Absolutely. So men newly diagnosed with prostate cancer have lots of treatment options. They range from surgery to remove the prostate, to radiation delivered from outside the body to the prostate, to even freezing the prostate, which is called cryotherapy. But importantly and increasingly, there's another option called active surveillance, which is watching a prostate cancer that appears not to be very aggressive. And making that decision to employ active surveillance is really where we use these new genetic tests like Polaris to help separate out the prostate cancers that appear less aggressive from the ones that need to be treated with surgery or radiation or that are more aggressive.
And what are some of the benefits that come along with that surveillance?
So the benefits of active surveillance are that you are able to put off indefinitely, perhaps forever, the potential side effects of treatment. So surgery and radiation for the prostate come with known potential side effects. And largely they're in the area of urinary difficulties like leakage of urine or sexual dysfunction, which have tremendous quality of life impacts for men as they get older. So the ability to put those off and avoid them is really why it's so important that we engage in active surveillance whenever we can. And really using active surveillance is reducing what's called over-treatment of prostate cancer. And we historically have had to treat most men who are diagnosed because we haven't had a very good test to separate out the lower risk from the higher risk prostate cancer. So we tended to err on the side of treating most men. But with the genetic information we get from the Polaris test, we're able to, with much greater confidence, separate the men who have the lower risk prostate cancers and watch them and treat the ones who are more aggressive.
And how does this Polaris genetic test actually work? How does this get to where we need it to be?
Great question. So I liken this to 3 cars on a racetrack. If you're asking the question, which car might be fastest, we're asking the question, which cancer might be most aggressive. If you look at 3 race cars, you might make an estimate based on their visual inspection, how the car looks, how the body's designed, and maybe how the tires look. You could then pick which one you might think may be fastest. What the Polaris test allows us to do is actually get under the hood and look at the machinery of the car. You're going to be able to make a much more accurate prediction of which one's faster if you can look and poke around the engine. And so that's what we're doing with prostate cancer cells, is we're getting into the genetic material of the cell, the genes. There's genes in every cell of the body, and they are the instructions that tell cells how to behave. And so we're looking at the genes of the prostate cancer cell, that cell's instructions on how to behave, and we see the patterns of the genes that are telling the cell either grow very slowly and don't divide very much, or the genes may be also telling the cell grow quickly, divide often. And that's the information that we collect from this Polaris test, and then based on that make a decision. You have a slow growing cancer, we can safely watch this, or the genes are telling us a story about this prostate cancer cell that it appears more aggressive and we should get into active therapy right away.
Well, I really feel like we've done a lot of education, Doctor, today, whether we were talking about surveillance or we were talking about genetic testing. Where can I go online to even, further get into this?
Sure. 2 different websites. The American Association of Clinical Urologists is aacuweb.org, and the Polaris test has its own website, prolaris.com, with lots of very good information about how to access the test and the valuable information that it provides.
Well, thank you so much for your time, Doctor.
Thank you.
Don't go anywhere. We'll be right back.